the deferred payment. Continue. Let me. Yeah. Just wanted to correct you.
Thank you, Mr. Speaker. A petition was submitted to the Clerk of the National Assembly pursuant to his guidance. It is accompanied by a motion moved by yours truly and seconded by the Honorable Director of Finance. And that motion, that petition rather, from the Guyana Human Rights Association and other concerned citizens is specifically addressed to the National Assembly of the Cooperative Republic of Guyana from members of the Guyana Human Rights Association and other concerned citizens, and it's intituled in the matter of the tragic death.
I take notice of what you have mentioned, and I just wanted to reaffirm the National Assembly of the process for petitions, right? So, the Honorable Member, Ms. Amanza Walton, desired that she was going to present a petition on behalf of the Guyana Human Rights Association. The standing orders relating to the position says that petition should come to the clerk, who will review it against the criteria which he has, and then forward a recommendation to the Speaker for it to go on the order paper. The physical petition, I should say not only the physical, but, and I consider electronic transmission to me, submission, came in at 9:32 a.m. this morning. At that time, the clerk was on his way here, like most of you, tied up in the congestion we've had. And when we met, the clerk hadn't had an opportunity to review that petition, so it wasn't able to make it onto the order paper. So just to reaffirm that a petition was submitted to the clerk, but no submission to the Speaker for onward transmission on the order paper. And this is one of the reasons why we were a little delayed in calling.
Mr. Speaker, thank you for that clarification. And I am confirming, therefore, that you're saying that the petition filed by the Guyana Human Rights Association in the matter of the tragic death of Miss Adrienne Young.
We're talking here of the process of petitions getting onto the National Assembly.
Mr. Speaker, I am aware. I am aware of what we're speaking, and so I am confirming that this is before the clerk for his review. And respectfully, I ask Mr. Speaker, when can we, as members of Parliament, when can the Guyanese public and the Human Rights Association receive a response from this Honorable House on this matter, given that this is something of significant
Honorable
national
Member,
import?
with respect to petitions, the standing order is quite clear. When a petition is presented, there are three options. One, it could be read, it could be circulated to members, or it could be moved to go to a special select committee. Am I in order, dear Mr. Clerk? Right? So we await the clerk's review and his recommendation to us.
Thank you, Mr. Chair.
Thank you.
Reports from committees. Oral questions without notice.
Honorable members, there are 9 questions on today's order paper. Sorry, we had an oral question without notice submitted by the Honorable Member, Ms. Amanza Walton Desir.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Honorable Minister of Home Affairs.
No, I'm not asking you to push. I just want to put the question. I just wanted you to relate what you sent because I have to rule on the submission.
Yeah, Mr. Chair, I had submitted to you for your attention a question for the Honorable Minister of Home Affairs, and it's couched in the context of the Private Security Services Act, particularly the Section 17(1), which regards the use of uniforms by private security agents. And my question to the Honorable Minister was, in the context of that provision, whether permission, because Section 17 requires that permission for uniforms and identification, etc., must be given by the controlling authority. And my question to the Honorable Minister was whether any permissions were given, particularly with reference to special uniform and special caps and the outfitting of private security agencies, whether permission has been given to any security agency for the wearing of masks, of ski masks or balaclavas.
Honorable members, I received the question and read it against the standing. Oral questions without notice should meet two criteria: one, importance, and two, urgency. And I felt that this question would best be presented as a question in really the urgency of it at this time.
Mr. Speaker, if I may, I acknowledge your guidance, but I want to add very briefly that I am not sure how this cannot meet the requirement of urgency. The entire Guyana saw over the last few days, particularly on the west coast of the west bank of Demerara, where there was a confrontation between a crowd of protesters and a private security firm. And the members of the private security firm, armed to the teeth, were all wearing ski masks and balaclavas, unidentifiable. Mr. Speaker, we are in a time right now where protests abound. How are we to understand who these people are? The Guyana police, they're not law enforcement. And so for me, it is a question that is very simple and it is a yes or no answer.
And while it might be simple, it's important, and the urgency criterion at this point, in my view, then make it qualifying.
Mr. Speaker, I want to put on record.
Thank you very much, Honorable Member. We need to move on.
One more issue. I wish to put on record that if tomorrow a mask.
Honorable Member, please. Honorable Member. Shut up. Mr. Clerk, please.
Questions on notice.
Honorable members, there are 9 questions on today's order paper. Questions numbers 1 to 5 are for written replies, and questions numbers 6 to 9 are for oral replies. For written replies, questions 1 to 3 are in the name of the Honorable Member, Ms. Annette Ferguson, and are for the Honorable Minister of Home Affairs. Question number 4 is in the name of the Honorable Member, Ms. Annette Ferguson, and is for the Honorable Member, Minister of Tourism, Industry and
coming up. Oh, now it is.
Thank
Sorry,
you,
Mr. Speaker.
Minister Teixeira.
She has asked me to defer as she's not in the country.
Thank you. Question number 4, we'll defer that answer until the Honorable Minister is able to submit that when she returns. Question number 5 is in the name of the Honorable Member, Ms. Annette Ferguson, and is for the Honorable Minister of Housing and Water. The answers to these questions, except question number 4, have been received and have therefore been circulated in accordance with our standing orders. For oral answers, question number 6, 7, and 8 are in the name of the Honorable Member, Ms. Tabitha Sarabo Hali, and are for the Honorable Minister of Labor. Honorable Member, Ms. Sarabo Hali, on question number 6, you may ask the Minister your question.
Thank you, Mr. Speaker. Mr. Speaker, can I indulge this National Assembly by asking that we take 1 minute of silence for Adriana Young, following her what has transpired over the last couple of days. Just 1 minute, sir. Is that something that we can do, please?
Unfortunately, I need to have you ask question number 6 of the Minister. We're going to get to that matter later on.
Thank you, Mr. Speaker. Number 6 question. Can the Honourable Minister state whether there has been any collaboration between the Ministry of the Public Service and the Ministry of Labour to conduct a formal needs assessment of the current and future skills needed for the public service and the country?
Honourable Minister.
Thank you very much, Mr. Speaker. The answer to the specific question is no. What I can say to the National Assembly that we have a consultant in-house at the Ministry of Labour that is presently working with all government agencies and ministry to assimilate the necessary information as regards the public service and its present and future staffing.
Honourable Member, Ms. Hali.
Thank you, Mr. Speaker. Can the Honourable Minister please state what was the timeline given to the contracted person to get to the consultant, to deal with this particular issue, and when can we expect some sort of results from that?
Minister.
Okay, so the consultant is at the ministry on a 3-year contract. I think the contract will be up next year, so 2 years of work has already been done. As regards the definitive timeline, that I will have to get to the National Assembly after consultation with the consultants and the senior functionaries of the Ministry of Labour.
Thank you, Minister. Ms. Hali, you can put question number 7.
Thank you, Mr. Speaker. This question number 7 is for the Minister of Home Affairs. Can the Honourable Minister state what is the number of registered Venezuelans in Guyana as of November 2024?
Minister. Minister, question number 7.
Thank you, Mr. Speaker. And I want to thank the honourable member for her question. The number of Venezuelans registered for the period October 1 to 30th of November 2024 amongst the 15,157 by region: 1, 7,507, Region 4, 23, Region 7, 1,101, and Region 8, 65.
Thank you, Minister. Ms. Hali.
Mr. Speaker, can the Honourable Minister please confirm Region 4's number? I didn't hear it clearly, sir.
Yeah, we're looking at the volume. I just signaled them because I didn't hear properly.
Mr. Speaker, he spoke when you spoke. I didn't hear him.
Minister?
Mr. Speaker, I was specifically asked for a period, and I gave it by region for the totals of for 15,157. I can share with the honorable member the reply to satisfy her with what I said was the number for Region 4.
Ms. Halley?
Mr. Speaker, I'm trying to, I'm really not trying to be facetious. I'm just trying to understand what information I'm receiving from the minister. The question stated as of November 2024, which means all 2020, 2021, 2022, 2023, up to November 2024, because that's when the question was submitted. So is the minister saying that as at November 2024, there are 15,000 registered Venezuelans in Guyana?
Mr. Speaker, the answer as I gave it and I read it. As of the 4th of October 2018 to the 30th of November 2024, and I repeat, by region, 1, 7,507, 4, 23, 7, 1,101, and region 8, 65, totaling 15,157. Yeah.
Ms. Halley?
Mr. Speaker, Mr. Speaker, Mr. Speaker, those numbers do not add up to 15,000. I don't know. I'm really. That's what the minister. I'm just supposed to accept it because he said it. Okay, all right. But the world heard that apparently the minister can't add. So let's move on. Can I go to question number 8, please, sir?
You may put question number 8 on.
Oh, sorry.
Mr. Speaker, can I ask a follow-up?
Honorable Mr. Patterson.
So, sir, I heard the Honorable Minister saying from 2018 to 2024, 6-year period that we only have 15,157 registered Venezuelans in the country, sir. Then he disaggregated it, and so I added it up, and that comes up to 8,596. The numbers he gave us with region 1, 4, 7, and 8. Can I ask the Honorable Minister where the other 7,000 Venezuelans reside?
Honorable Minister.
Mr. Speaker, let me apologize for some inadvertence in the numbers. I will confirm the numbers and submit them as a printed reply.
Thank you, Honorable Minister. Honorable Member Ms. Halley, question number 8.
Mr. Speaker, maybe this question may help us to clarify what we weren't able to get at 7. Can the Honorable Minister state what is the monthly number of arrivals of Venezuela in Guyana? From January 2024 to present, and their points of entry.
Honorable Minister.
Mr. Speaker, I want to ask the Parliament's leave So review and confirm these numbers again before making further reply on these questions.
Thank you, Minister. Honorable members, we can move to question number 9. The Honorable Member, Dr. Karen Cummings. You may ask your question.
Thank you, Mr. Speaker. Can the Honorable Minister of Health inform the National Assembly whether high-risk mothers in Guyana can rely on the emergency care available and delivered at the health facilities in the 10 administrative regions?
Honorable Minister.
Thank you very much, Mr. Speaker. And let me thank the honorable member for her question. The short answer can be yes, but I want to also say that the way that we determine whether a mother is at high risk or not is that we look at the maternal age, so whether somebody is below the ages of 16 or above 35. We also look at the obstetric history, and there are lots of different things that we look at, including whether they had more than 5 or more deliveries, whether they are giving birth for the first time, whether they had a previous stillbirth or a neonatal death, whether they had previous miscarriages, whether they had a preterm birth or a low birth weight baby, whether they had a previous cesarean section, a history of postpartum hemorrhage, a history of pre-eclampsia or eclampsia, and of course we also take into consideration the current pregnancy, whether it's multiple pregnancy, whether they had bleeding in the current pregnancy, whether they have a suspected or confirmed abnormal fetal growth, whether there's a breech presentation, and whether they have severe anemia. And there are some other conditions too that we look at. We also would assess the mother to see whether she has hypertension, which is probably chronic or due to the pregnancy, whether or not she has diabetes, a pre-existing condition, or gestational diabetes, whether she has heart disease, kidney disease, sickle cell, asthma, HIV or STIs, a history of TB, or any mental health conditions. Infectious diseases, we also screen for malaria, dengue, Zika, and HIV. And we also look at social and nutritional factors, social being looking at whether there's substance use, including alcohol, tobacco, and drugs, and so forth. So using this as a way of screening, one of the things that all our health facilities look for is early identification. We also do timely referral if we find somebody at risk. And if they're at risk and we do the referral, they'll get continuous specialized care. And we ensure that this mother delivers in a hospital. And we do also comprehensive postnatal follow-ups. Mr. Speaker, over the last couple of years, we have been able to do a number of things that would have enhanced the quality of care that we have been delivering. So, for example, in most of our regions, we have added new theaters where, if necessary, we can do cesarean sections and delivery. And those theaters include in Region 1, we have added a new theater at Mabaruma, we have added a new theater in Kumaka, we have added a new theater in Port Kaituma. We also have added here on the East Bank a theater at Diamond. We have in Region 5 a new operating theater at Maikoni. We have also added one at Camarang, one at Madhya, one at Aishalton, Anai, Karasabai, and we have at Sand Creek, and we are soon to complete one at Kukwani. And this does not include the existing theaters that we have in our existing regional hospitals, such as Sadi, West Denver, the Georgetown Hospital, which is our tertiary facility, the Amsterdam, the Linden. In addition, in terms of theater capacity, another and each of these, there will be a birthing suite, and if necessary, there are also 3 operating theaters that would be there. So in terms of facilities, we have adequate facilities. And those places that I mentioned, those theaters was built in the last 2 to 3 years and open and have been operational. In addition to that, Mr. Speaker, we also have built a number of maternal waiting homes. So persons who are at risk, they would come to these waiting homes and wait there until they go into labor, and then they come across to the hospital. And we have waiting homes now at Mabaruma, that's a 14-bed facility. Komaka, where we have a 20-bed facility. We have a waiting home at Long Creek, a 5-bed facility. One at Kato, which is 16 beds. A facility at Lethem, which is 40 beds. And one at Anai, which is 20 beds. And we are going to continue this to add waiting homes to our various regional hospitals. In addition to that, Mr. Speaker, in terms of the personnel that we have at these sites, across the region, we have 17 specialists supported by registrars and GMO. We have another 30 persons who specialize in obstetrics care. But obstetrics care, Mr. Speaker, is not just about the mother, it is also about the neonate. And one of the things that we have done over the last couple of years is to improve neonatal care across the country. We have set up an NICU at Mabaruma Hospital. This was started in 2023. We have also set up one at Komaka, which was also started in 2023. Another one at the public hospital, Sadi. Another one at West Demerara Hospital. At the New Amsterdam Hospital, we have expanded the NICU there. This is part of what the question entails, whether we can provide emergency care. If you don't understand the thing, I can explain that to you. Bartica, we have also added an NICU. Lethem, we have added another NICU there. These places, Mr. Speaker, did not previously had NICUs, and we of course have one in Linden. And to look after these children, Mr. Speaker, we have 13 consultants that are spread across the different regions, and they are supported by an additional 33 registrars and GMOs. So I hope that answers the honorable member's question. Thank you very much.
Thank you, Minister.
Mr.
Dr. Cummings.
Yes, I just want to thank the minister for what may appear a comprehensive answer. But I just want the minister to know that that's all well and good. We were there in our term, we started waiting homes and so forth, which is good, and you've continued it. But the point is the monitoring part. Is the monitoring part that it's really account for some of these deaths, which are preventable, you know? So you can't be sending home where you should be keeping and keeping where you should send home. So those kind of, you know, just to tweak those areas. I know you're making effort, the Department of Maternal Child Health, I know they're trying. And but just that to focus on that particular areas. Because when you ask an interview of the patients and the parents and the relatives of those who would have gone to like the New Amsterdam hospital and so forth, those are some of the things you know, the attention wasn't there. They weren't properly monitored. So in all that you're doing in terms of infrastructure, you know, and trying, you know, to maintain the training, but the monitoring you need to spend some time on. Thank you very much.
Honorable Minister.
Thank you very much, Mr. Speaker. Again, I'm not too sure what the honorable member is referring to there. So let's have something very clear. Indeed, the last government, there was an IDB program that looked at maternal and child health. And this was borrowings that they had from the IDB. And one of the components of that program was to look at the development of waiting homes. But under the last government, not a single waiting home was developed with that money. It took the PPP to come into government, and the first one we opened, it let him. So I'm not sure what waiting home you're talking about, because zero was opened under the APNU AFC. And we should recognize that. You had the money, but you did nothing with it. Zero was open. So let's get that very clear. The other thing in terms of monitoring, every single mother that comes for care to us, if they come in during their 9 months, we at least want to ensure that every mother has at least 8 visits. The first visit in the first trimester, 3 in the second trimester, and the rest in the third trimester. If they're at high risk, we would encourage them to come even more often, and we make sure that we monitor them. And I have a whole list here. I can go through this. All the things that we do. And every single test that we do for every single mother that comes through our system. So we should be proud of this system, because this is helping to keep women safe during pregnancy. We should be proud of it. Thank you very much.
Thank you, Minister. Mr. Clerk.
Statements by ministers, including policy statements. Personal explanations. Requests for leave to move the adjournment of the National Assembly on definite matters of urgent public importance. Motions relating to the business.
Relating to a request to move the adjournment of the Assembly on definite matters of urgent and public importance from the honorable member, Mr. Jermaine Figuera. I'll ask him to state his issue.
Thank you, Mr. Speaker, for your accommodation. I'm about to present a motion for the establishment of a national child emergency notification system. But Mr. Speaker, it would be remiss of me if I did not seek your permission in asking that all members of this House stand with me for a minute of silence for the tragic and horrendous loss of lives in such a short span of time in Guyana. For two Leonards, Ronaldo Peters and Keon Pogene, and for the recent 11-year-old Adriana Young, in which this motion I'm about to present seeks to honor.
I concur with you. Thank you.
Thank you, Mr. Speaker. Thank you to all members of this House. Mr. Speaker, this motion reads, whereas the tragic and brutal abduction and murder of 11-year-old Adriana Young has shaken the collective conscience of our people of Ghana, transcending all ethnic, religious, and social divides. And whereas there is a national outcry for urgent reform to enhance child protection and strengthen public safety mechanisms. And whereas experiences in other jurisdictions, including United States, Canada, the European Union, have demonstrated the effectiveness of child emergency alert systems, such as the Amber Alert, in facilitating the rapid recovery of missing children and saving lives. And whereas the swift dissemination of critical information to the public through mobile devices, media outlets, and public networks have proven to dramatically improve child recovery rates and deter criminal activities against minors. And whereas Ghana, as the fastest growing economy in the world, must proactively implement security measures to protect its most vulnerable citizens, especially its children, amidst increasing exposure to criminal elements. And whereas the establishment of the National Child Alert System will not only improve law enforcement's ability to respond promptly to child abduction, but would also empower the general public to actively participate in safeguarding our children. And whereas the implementation of a National Child Alert System would stand as a lasting and meaningful tribute to the memory of Adriana Young, ensuring her life and untimely passing serve as catalyst for lasting national protection reforms. Be it resolved that this National Assembly calls on the government of Ghana to immediately begin consultations with stakeholders, including the Ghana Police Force, telecommunication providers, civil society organizations, and child rights activists, to design and implement a national child emergency notification system. Be it further resolved that within 6 months, the necessary legislation and regulations be drafted and tabled to establish the operational framework, responsibilities, and protocols to govern the National Child Alert System. Be it further resolved that the system be named the Adriana Alert System in honor of Adriana, to symbolize Guyana's commitment to the protection of every child within its borders. Further, be it resolved that annual reports on the system's activation, effectiveness, and outcomes be laid before the National Assembly to ensure transparency, accountability, and continuous improvement. Mr. Speaker, I am usually a strong emotional person, and I have witnessed that. I have buried family members dear to me, close friends and associates, and on few occasions, Mr. Speaker, I seldomly shed a tear publicly. But Mr. Speaker, I saw, like many Guyanese, and I'm confident that you and all of us here in this house equally witnessed the emotional anguish of those parents who lost their child in such barbaric manner. But what got me in an emotional state, Mr. Speaker, is when I saw, like you, when I saw, like many Guyanese, Mr. Speaker, Adriana's father, a man who without doubt loved his daughter, jumped into the pool, Mr. Speaker, and grabbed his lifeless baby girl. Mr. Speaker, the cry he cried out is a cry of
Yes,